For the next 15 or 20 minutes, I'll talk about the oxygen support devices which are commonly used for the COVID-19 patients. Okay, so if there is one thing which is most commonly required or which is a compulsion for all the COVID patients, it is oxygen. So whenever your patient needs oxygen, there should be some kind of an interface between the patient and the oxygen supplying device. The interface is the one which makes a difference in how good you are able to receive the oxygen from the cylinder or from the supplying machine. So I'll be talking about two such interfaces. One is HFNC and other is NIV. NIV here in all my presentation will be a portable NIV and not an NIV on the invasive ventilator. Even on the invasive ventilators, you can use them either in a non-invasive mode or an invasive mode. But here I am not going into invasive ventilator. Here I am restricting myself to portable NIV. So moving forward, there is a 45-year-old COVID-19 patient with a severe disease, that is a CT severity of 19/25. Here, if at all there are a lot of young doctors who are there in the audience, whenever you are telling or you are discussing about a COVID-19 patient to any of your colleague, the things which you need to tell is whether it is a RT-PCR confirmed case. Once it is an RT-PCR confirmed case, then what is the CT severity? So many patients, so many times I hear people telling CORAD 5, CORAD 6. So CORAD 4, CORAD 5 is to say whether your patient is COVID or not. It doesn't give you the severity of the disease. CT severity gives you the extent of the lung involvement. So whenever you are discussing about a patient, first thing is day of the disease, second thing is CT severity. Because whenever the CT severity, there are again various scoring systems out of 25, out of 40 based on the lung involvement. Most of the hospitals are using score over 25. So it is nothing but the extent of the lung involvement. If your entire lung is involved, you are given a score of 25, with each lobe being given a score of 5. So the next important thing is the day of the disease. Why? Because most commonly patients are decompensating between day 8 to day 14. So whenever it is in the first week, the patient still will be stable. So most of the time the decompensation is happening in the second week. So that is the reason day of the disease is important. So here it is a 45-year-old patient with a CT severity of 19 out of 25. That means it is a severe disease. A score of less than 8 is considered to be mild. 8 to 15 is considered to be moderate. Anything more than 15 is considered to be severe. So it's a severe disease based on the CT severity. Presented to you on the 12th day of the disease. Presents to the emergency department with shortness of breath, with a saturation of 80% on room air. So saturation, I think now even your smartphones are showing the saturation. So I'm not going to explain anything about it. It is the oxygen percentage, which can be seen in the pulse oximeter. So a severe disease patient comes to your emergency room with a saturation of 80%. So no prizes for guessing. What is the next step? Obviously, you need to connect oxygen to the patient. So how will you connect the oxygen? So it could be a nasal prongs, it could be a face mask, it could be a non-rebreathing mask, it could be a Venturi mask. I think all of you will agree with me. So what are the various interfaces for connecting oxygen to the patients? Nasal prong, face mask, non-rebreathing mask, Venturi mask. I think most of you will get this. Any of the above. Sorry, my animations have gone missing. So the answer is any of the above. So in this, nasal prongs, face mask, non-rebreathing mask, Venturi mask. So what is a Venturi mask? I think most of you will be knowing about nasal prongs, face mask, and non-rebreathing mask. But what is a Venturi mask? So Venturi mask is a fixed flow device. So this is my next question. What type of oxygen delivery device is a Venturi mask? So Venturi mask is a fixed flow device. So what is fixed flow device? Oh, someone has answered well, Dr. Divya. So absolutely correct, Divya. It is a fixed performance device. So what is the difference between a fixed performance device and a variable performance device? It could be either performance or flow. So whenever you call a fixed performance device, the entire flow which is required by the patient comes through the interface. Whenever you call it a variable flow device or a variable performance device, a part of the flow comes from the atmosphere. So what are the variable flow devices or the variable performance devices? Your nasal prongs, your face mask, your NRBM, all these things are variable performance devices. So what is the major difference between variable performance and fixed performance device? Your FiO2, that is the fraction of the inspired oxygen which the patient is taking, is fixed in a fixed performance device and variable in the variable performance device. And on what does the FiO2 depend in a variable performance device? It depends upon the patient's effort. If you are trying to breathe a lot, if your peak inspiratory flow rates are very high and you are just providing 5 liters or 4 liters of oxygen, your FiO2 will be less. Your peak inspiratory flow rate is not very high and you are providing an oxygen of 4 liters or 5 liters, your FiO2 will be a little high. So the FiO2 or the fraction of inspired oxygen being given will be variable. So these are the major differences between a fixed performance devices and a variable performance device. In a fixed performance device, as I already told you, FiO2, that is the fraction of inspired oxygen, is fixed in a fixed performance device and is variable in a variable performance device. So it provides a specified FiO2 throughout the respiratory cycle. Here it provides an FiO2 based on the peak expiratory flow rate or based on the patient's respiratory effort. So because the flow rate is fixed, CO2 rebreathing doesn't happen through the fixed performance device, but whenever you are using a variable flow device, rebreathing can occur. So what are the indications for a fixed performance device? Whenever your patient's oxygen requirement is very high, it is better to go for a fixed performance device. Whenever your patient's oxygen requirement is not very high, you can go for a variable performance device. As I already told you, the example for a fixed performance device is either a Venturi mask or an invasive ventilator wherein you can control the FiO2, or a HFNC, again wherein you can control the FiO2. But the normal nasal prongs, face mask, nasal cannulae, all these are variable performance devices. So here you can answer in the messages itself, Dr. Divya. So what is the principle on which a fixed performance device works? So it works on Bernoulli's principle. Okay. So Bernoulli's principle is a principle wherein the energy is constant. Whenever your kinetic energy decreases, the total energy will be constant, as a result of which a fixed FiO2 will be given to the patient. So the Bernoulli's principle is the principle on which the fixed performance devices work, and this principle is there even in the suction devices which are there. Okay, so now I'll be coming to my topic.